Yes, delighted to be here this evening to start the MiniMed series on mental health matters. As Maria said, I am working at the moment with, it sounds very wordy, the psychiatric epidemiology research across the lifespan group, which is why we shortened it to PEARL, because it's easier to say. But essentially what we do is do research on what are the kind of rates and the determinants of mental health in our general population, so rather than just sort of clinical populations. But really what I wanted to do tonight is to try and distill some of what we know about mental health from the body of research, but to try and simplify it into sort of layman's terms so we can kind of make sense of what is all this research telling us about mental health. And it's a really, really good start, and I'm delighted to be the first up for the MiniMed series, because the World Health Organization tells us that there could be no health without mental health. So that if we're going to look at the whole notion of our full health as human beings, we need to factor in our mental health at all times. And that if we don't have good mental health, it is likely to compromise our entire kind of health systems if we're not careful. So I'm going to cover three things. I'll try and keep to time. But one is that very kind of core question of what is it that we actually mean by mental health? What does that term mean? Because we hear it over and over and over again. And yet people can be quite confused about how would you know you were mentally healthy? You know, what would be the factors that might give you an indication that you were? So to that end, I'm going to start with this quote. So I don't know if people have seen this before. Anybody seen this one before? So life isn't about waiting for the storm to pass, it's about learning to dance in the rain. Anybody kind of give me with a nod of a head a sense of whether you think this is a good phrase or statement to represent what it means to be in life? Yeah? So the consensus, any defectors who think, no, this is a ridiculous statement to make, and you know, this isn't what life is about at all? Not a defector, or not anybody who wants to say they're a defector in the room? It's a really, really interesting phrase. People generally really respond very well to it. It seems to make sense to people, because what it tells us is that if we're waiting for the perfect life, we will wait forever. That life isn't like that. The existential philosophers tell us that, you know, to exist is to suffer. To be human is to suffer, and it is part of the human condition. And that what we know is that for every single one of us, there's going to be times in our life where it is very stormy. It's very, very difficult, and it's hard to manage. And that really this is telling us something about mental health, about how is it that we can be in this world that we live in, and storms to various degrees for different people, and still manage possibly to dance in the rain. Now, there is a caveat to this, because for some people it's stormy and rainy all of the time, or persistently over an extended period of time. And in those cases, it's much more difficult to dance. Sometimes you just need to kind of bed down, get your umbrella up, and hang tight and try and get through that storm. So for people whose storms don't pass, or for whom the storms go on for a long time, it can be much more difficult, as I said, to do that. So we need to think about that in terms of, you know, what does that mean for us as human beings and our mental health and how we manage that. But I think it does get to, I suppose, maybe something about what, say, the World Health Organization would say is a definition of mental health. There's lots of definitions that you might read. So this one says it's a state of well-being in which the individual realizes his or her abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Anybody seen that definition before? So you can see that one of the myths in some ways about mental health that can be a problem for people is that they often think about mental health possibly as needing to be happy or up or good and feeling good all of the time, whereas mental health isn't about that, and it's about more than just how you feel. It's about how you are in the world. So not only with yourself, but how you manage in the world. So having good mental health in some ways is about being able to navigate through those storms without them being totally destructive for you. And that you begin to find a place for yourself in the world that makes sense for you, and that gives you some sense of personal satisfaction or sense of well-being along with that. And critically, people who have good mental health feel all of the difficult range of emotions that everybody is likely to feel. They feel sadness, they feel anger, they feel guilt, they feel those, but they don't get overwhelmed or so overwhelmed by those that they cease to be able to function. So to be mentally healthy is to allow yourself to feel, allow yourself to be, and to connect with, as I said, who you are, and to find a way to manage those stresses that come with life. There's a really interesting quote that I found from it's an Australian psychologist who wrote this in about 10 years ago, but he talks about when you look at people who seem to have good mental health, and these are really important because when we come to nurturing your mental health, these are the kind of factors I want you to be thinking about. So having a sense of place, we are, as human beings, we like to feel like we belong somewhere. So for some people, that sense of kind of place might be a geographical place, it might be a sense of place within your family. Not everybody has a good family, and sometimes they have to get a sense of place or belonging outside of their family. But having a sense of place is terribly important. Really interesting, knowing how to initiate and maintain meaningful connections. So it's not enough possibly just to be able to kind of get to a party and chat to people, but it's about the maintenance of relationships that have meaning for you. And again, you have to think about, and each of us in terms of our own mental health, about what those connections would be. Failing and not being crushed, terribly, terribly difficult for people. You know, when you're having times where you feel you have failed, and not, again, letting that overwhelm your sense of self or your sense of purpose in the world. Rising from the depths of rejection to have hope, and we know for many people that is terribly, terribly difficult, and we're seeing that in some of the statistics around things like suicide, is people losing a sense of hope, becoming despairing, and not seeing anything in the future, which is why they would say having a purpose for living beyond the moment is important. Holding on to a dream, you know, that beyond yourself. Having the capacity to influence change and make a difference, and we're going to come back to that at the end about why that's so important. But if you've ever been in a friendship, for example, where you're on the receiving end of all of the care and the consideration, and you have somebody who doesn't allow you to give back, that there's no reciprocity, it's usually not a very satisfying relationship to be in. Usually people want to feel they can contribute as well as receive. And again, people who have good mental health seem to be able to do that and get a sense of being able to contribute. And here's the really tough one. The real human challenge is being significant because of who you are in the moment. And that is the core thing of acceptance of self. And if I were to ever say in all of my years of experience clinically, is there a thread that kind of ties every client that I've worked with, every person, it is a lack of acceptance of self or a critical sense of self. And that is the thing that we struggle with probably over the course of our whole lifetime, some of us more than others. So those are the things that when we talk about mental health, it is about if you can have some or more of those, you are more likely to be mentally healthy in your life. And the absence of those might put you a little bit more at risk. So the question then is, well, look, if that's what it is to be mentally healthy, you know, why is it that some kids grow up to be happy or happier and others don't? You know, what is it that really seems to influence our mental health? What are the things that go together to kind of form this kind of picture? And it's really interesting because when you look at people, sometimes you say, well, you know, here's all these children who grew up in the same family, and one seems to have grown up and done okay and kind of been in the world and seeming to be mentally healthy, and somebody else hasn't. And what is that about? So we'll unpick that a little bit, but I think it's important to think about, you know, it's a complex thing. You know, our mental health is a terribly complex because it's about who we are as well as all these kind of biological and psychological processes going on within us. And the real question is this true? Are those kind of like, yes, I know those people kind of laughter? Anybody know somebody about whom you would say that person was just born miserable? Yeah, we have some people like that, we know. So, you know, and there is a sense sometimes that people feel like this, like there's just nothing good here. Is it really true to say that somebody could be born miserable, that it is their sort of predetermined destiny to be miserable from the moment they exit the womb? No. So why is it that people become miserable? Or why is it that people become depressed? Or why is it that people become very anxious? And that brings us to that real kind of core question of nature-nurture. And you'll hear that, you know, of parents and talking about, you know, small children saying they're very different. Their personalities seem different right from the get-go. But the really interesting thing is that if you are a very smiley baby who's, say, very physically healthy, you're more likely to elicit a more smiley response from the people around you. If you come out and you've got colic and you're sick, and you scream from morning to night, it's much harder for the people around you to give you that kind of response all of the time. So that very small things can set up a dynamic right from the get-go that might influence over time how people respond relationally to each other. But if we look at sort of the core, and if we put together some of the research, there are some things that clearly have been identified as factors that go together to try and make sense of, what determines whether you're going to be mentally healthy or have mental health difficulties. These are kind of visual representations. Anybody want to shout out and what they see? Genetics. Environment, yeah. Anything else? What was that? Peers, friends, peers, yeah. The weather. It's interesting. It's interesting because the weather can matter for some people. Communication. Okay, so here's what we do know, is that genetics at some level do matter. So there's no question. And one of the things when you talk about something like genetics that's difficult for people is to think, well, if I'm going to seem to have a genetic loading, does that mean it's inevitable that I'm going to have difficulties because of my genes? But actually what really research is telling us is that it's quite a complex interaction between your genes and your environment interacting together that seems to be at play rather than just your genes. So if you look at things that might be risk factors, you might say, okay, well, I might have genetic risk, for example, if you, in the case of something like an illness like schizophrenia, if you've got two parents who both have schizophrenia, there's a genetic component to risk that comes with that, but it's not inevitable. Risk does not mean that anything is inevitable, it just is a risk factor that you're loaded with. So genes seem to matter. Our very early formative, this second image of the little foot in the hand, our very early experiences of caregiving matter. So those first couple of years, we often hear that the first couple of years are terribly important because they bed down for us something about what it is to be in the world and trust and who it is, and sets up, as I said, some of these relational systems and some beliefs that we might carry about ourselves and core beliefs about ourselves and the world. The family that we grow up in, I don't know anybody who can't argue that the family that they grow up in or don't grow up in if they're removed from their families, doesn't matter. It does matter because lots of things happen in families, and you can have lots of difficulties in families, you can have very well-functioning families, but all of the dynamics, so if you've grown up with somebody where there's addiction in the family, or where their parent has been ill, or where there's family illness or other issues happening, that again may be a risk factor for you because your family environment wasn't necessarily as conducive to mental health as you might want it to be. Our peer relationships definitely matter, and certainly a lot of the research that we're doing in the Pearl group is showing that bullying matters. People who are bullied, for example, by their peers are more at risk later on to have mental health difficulties. But actually any form of violence or assault seems to be a risk factor for people, particularly in their early years. Down here in the bottom left, have this idea that not only do we look at, so you kind of look at, okay, there's genes and there's kind of biological risk factors because if you were sick as a child and in hospital, that might make a difference, both the illness and the hospitalization. And then there's all these family relationships, but actually kind of systemically in society, if you're somebody who experiences discrimination or stigma or oppression, you're more at risk in relation to your mental health. Not having access to somebody to support you is a risk factor, so you need to have somebody who's available to you. And then all of these things lead to two things. One is how we think about ourselves and the world around us. So the cognitive behavioral therapists very clearly, work in a way that they say therapeutically, how you think affects how you feel and how you behave. And your life experiences influence how you think, and therefore that influences how you feel and how you behave. And at the very end, people who do not accept themselves, who are critical and rejecting of themselves, are more at risk in relation to their mental health. It's much harder to be mentally healthy if you dislike yourself intensely. So those factors come in. So when we look at that, negative experiences in those areas would be risk factors. Positive experiences in those areas would be protective factors. If I always think of protective factors, I kind of think, when kids go bowling, and you can get those inflatable things that go down the gully, so the ball never goes into the gully, you'll always hit. Well, the more you can kind of boost your protective factors, the more like putting that down the gully. So the ball might be a bit wobbly as it goes down, but it's not going to go completely off the edge. So we try and look at that in terms of protective factors. And based on that, there are particular kind of things, these aren't all of them, but some kind of core things to be mindful of that might be selectively kind of looked at as risk factors. So an early life loss of somebody significant in your life is a risk factor. Children who've lost maybe a parent. And again, that isn't any reflection on you know, whether they were parented well thereafter. It just happens that that loss of a significant person in their life may be a risk factor for later difficulties. Anybody who's been a victim of violence over the course of their life, similarly a risk factor. People who are institutionalized or in prisons, so some of the research has found that, say, rates of mental disorder in prison populations, anything between 60 and 90%, depending on the study. So you see these really high rates. So the question is, which came first? Was it the fact that they had mental health difficulties that maybe led them into crime, or was the experience of being in the system contributing to their mental health problems, if that makes sense? But that's certainly a risk factor. People who live in poverty, and the recent report has just come out about how many more children in Ireland are now in poverty, who are poor, and that is certainly a risk factor. Young men. And we know that because the statistics are telling us that young men are at risk. And part of the risk for young men is that young men don't seek help. That's one of the issues, that something happens around the process of translating. Again, we'll talk about that, you know, those difficulties you might have into reaching out and getting help. People who have educational difficulties or early school leavers are an at-risk group. People who've experienced discrimination. The other thing is this one with the 2 arrows you see down the bottom. Points of transition in your life can be a vulnerability or a point of vulnerability in relation to your mental health. So you need to be very cautious, and particularly younger people, around times where things are changing. You know, so if you're carrying a bit of vulnerability, that might increase your risk at that stage. People, for example, who are homeless. So when you look at that, you might think, well, okay, maybe I know people who have experienced like that, have had those kinds of experiences, or I've had those kinds of experiences, or I work with people who've had those kinds of experiences. And it's just to be a little bit extra mindful of the fact that they might constitute a specific risk, you know, that on top of the other risk factors that are there. And of course, all of this, and one of the really interesting is if you begin to, you know, look at, and I am not sort of a neuropsychologist, or I'm not a neurologist or anything like that, but what we know is that the effect, both, you know, in terms of some of those adversities or difficulties, can affect the brain. And we certainly know that people who have mental health difficulties and mental disorders, there are structural changes to the brain, so you know, in terms of the grey matter, white matter of the brain. There are neurochemical changes, so there are differences in the kind of levels of particular kind of chemicals within the brain, and that really many people would say, you know, mental disorders is a disease of the brain, because what they're able to do is quantify and say, well, actually there are marked changes. This isn't just you saying, I don't feel okay. There are things happening chemically or structurally in the brain that are affecting all the things that go with your mental health, like your mood or your motivation or your concentration or your perception can be affected by these. And of course, the brain, we can't see it. So you don't see those changes that are going on in your brain, so it can be very hard to make sense of. But actually we know that those changes and things like poverty and adversity can actually adversely affect those kind of biological structures, including the brain. So just really important for people to kind of acknowledge that, because sometimes in mental health we're just thinking someone's just not trying hard enough, or we think ourselves we're just not trying hard enough, and not recognizing that maybe there are chemical processes at play that are really affecting somebody's ability or capacity. So in the same way that if you broke your leg, you wouldn't expect somebody to be able to just walk on it unaided without crutches. So we need to be mindful of that. But, and here's a but, why do I have these two up? Oprah. What do we know about Oprah? Anybody know much? She was abused as a child. Survivors. Okay, so they go, if those are risk factors, like Oprah Winfrey should not be doing well in life. If we were to just count up her risk factors, born into poverty to a single mother who was very young, she was raped when she was 9, she had a child when she was 14, that child died. You know, she wore potato sacks for clothing, she was in such poverty, and yet she's the most successful African-American woman in the world and in the history of the world. So like everything that we know that tells us she was at high risk didn't pan out for her to result in her actually having the kind of difficulties or the kind of life we might have expected. And Nelson Mandela, who didn't have the early experiences of adversity, but had later adversity for 27 years, came out intact. And actually, some would say, you know, that idea of resilience is that you may actually thrive in the face of adversity. So what we know, and all of the early research in resilience was actually with children of parents, and particularly mothers who had schizophrenia, who were unable emotionally to give the kind of quality of care to their children. And it was about understanding what is it about some children that they're doing better in that environment than others. And there seem to be traits like, you know, people who are more resilient tend to be better at making their own decisions. They tend to feel more in control. They seem to have better social relationships. And here's the thing, those are all the things that matter in your mental health. So if you boost your mental health, you boost your resilience. And of course, these models also tell us that, as I said, one of the things you never want to feel, and is important, is that you acknowledge risk, but you don't ever see risk as I said, this kind of fait accompli, that you're destined to a terrible life ahead. That there are possibilities for you to kind of go against the odds, like other people who've been very successful, and to have a meaningful life for yourself. So, you know, when you look at people who work in mental health, the model that they tend to talk about, I don't know if people have ever heard this, is the stress vulnerability coping model. So you've got vulnerability, and we talked about those risk factors that make you vulnerable. Some of those are factors you cannot change. So you cannot change your genetic makeup. You cannot change what happened to you in the first 2 or 3 years of your life. You cannot change other people, and in that sense, you cannot change your family. But there are other things that you might be able to take more control of and change in terms of your vulnerability that you might have. So that what you try and do is reduce any of the risk factors that you can control, particularly at a time when you can control them. So for us now, it's by thinking, are there things happening, or are there kind of dimensions in my life that are not working so well, and how can I bring those ones down? And how can I, as I said, like our little inflatable buffers on the bowling alley, how can I increase the protective factors so that I'm buffered against the stuff that I can't change? Does that make sense to people? So that we look at vulnerability like that, then we look at stress, and then we look at the concept of coping. And that's why I have, oddly, it looks like I'm about to do a magic experiment, but I'm not. I'm going to pull this in front of me. I just thought it might be useful to sort of say, well, you know, how does that work, really? So I'm going to have glass A. And the glass we could take as sort of, look, this is me and how well I cope, okay, is that glass. And inside the glass, all those little balls are all of the vulnerabilities and the risk factors, okay? So that's, and then what happens, so you're kind of going on through life, everything is going fine. You might have vulnerability, you might have risk, but you might be doing okay. And there's no real issue for you. But then you get stressed, or that you experience stresses. So it might be one really big stressor, you know, something that really hits you massively, or it might be loads and loads and loads of little stressors that build up over time. So stress isn't always sort of one thing or one trauma. It could be lots of small things. So this, if anyone can see it, you're not going to see it very well over there because I have to do it on the tray, or else I'll get blue dye all over the floor. So this is stress. So if I put this in with my risk factors, I'm literally at the top. I'm literally about to overflow. Any extra stress is going to result in what? Overflowing. So you reach a capacity for managing stress based on how well you cope and what risk factors you carry. So if in this glass, I've taken out the things I can change. I've said, look, here's the things that I can do to try and boost or reduce my vulnerability. So I've less in there, but I've the same amount of stress. So when I do this, I have more capacity. There's a little bit more room there as I take some out. And the more I can take out, the more capacity I have maybe to deal with stress. But really what seems to matter, particularly because a lot of those vulnerability factors you can't necessarily change, and it's trickier, is what you can do is try and make yourself bigger in terms of your coping abilities. So if you can increase how well you cope with stress, then even with the same amount of risk factors, you'll have way more capacity. And in some ways, it's a very simple model, but it is the model so that when people enter into, say, mental health services and people are trying to make sense of why this is, it's the best explanation that people tend to look at. It's saying, well, there seems to be no risk factors, they seem to have had stress, and again, the kind of particular dynamics of how much risk or how much stress that they have, but essentially that they reach capacity. They reach capacity, and it compromises, and it really possibly, you know, brings them to a point of mental ill health that they might not otherwise have had. I said it's an explanation that makes sense, and it's one, as I said, that the critical thing is that you can alter to a degree, you know, how much stress you might be able to bear or your mental health if you increase your coping and try and manage and control any risk factors that you have. So I kind of put together here a mental health-ometer, which I find difficult to say. So if I get it wrong, because I tend to say mental health-o-meter, but it's a mental health-ometer. And if we're going to look at mental health, and we look at this, what we see is it's a continuum. It's literally you move from a place of being very mentally healthy, right here on the kind of green side, right over to kind of mental ill health. And most of us are somewhere along there, and we move along there. It's not a static thing. You're not always just in one place on the mental health-ometer. So what we're trying always to do is stay over here on the left, towards good mental health, and we're really going to try and stay away from being on the right, which is mental ill health. But again, it could be quite tricky depending on what you're carrying. And in the middle, we have people who maybe have mild to moderate mental health difficulties. So when we're thinking about mental health, you think about kind of promoting your mental health by trying to keep over here to the left. When we think about people who are struggling, we have to think about what do we do if we're in the blue? You know, where do we go? How do we manage that? How do we know? And what we're going to look at is how do we know we're over in the orange? You know, what are the signs that might tell us that something more serious is going on and we maybe need to take more action? So we look at signs. This is one of the, I suppose, what you know, the psychiatrists and GPs and others would use. They use a manual to try and, you know, look at diagnosing disorder. So they say mental disorder, which is somewhere over in the orange, is characterized by clinically significant disturbance in an individual's cognition, that's their thinking and their thinking styles, their emotional regulation, how you manage your emotions, or their behavior that reflects a dysfunction in the psychological, biological, or developmental processes underlying mental functioning. So they're usually associated with significant distress in social, occupational, or other important activities. And I'll unpick that a little bit, but it's important to remember that, I suppose, when you look at, you know, how we organize and think about mental health, there is a category that is considered to be a mental disorder, you know, where you have crossed the line from some moderate difficulty into something more serious. And doctors use a variety, depending on the disorder they're looking for, of kind of criteria that you have to meet to fit into this broad understanding of what a mental disorder is. So the main categories that people, you know, think about: mood disorders. So we've got depressive disorders where your mood is down. But we also have mood disorders where your mood goes up. So you become manic, you get, you know, what people describe as being high, and a mixture of those is bipolar disorder, previously known as manic depression. Anxiety disorders, we hear less, I think, about anxiety disorders because there's such a burden associated with depression, but anxiety disorders are terribly disabling for people because anxiety is about fear. And fear is often about the future, and then you become paralyzed if you're anxious, because you feel you're worried about something that's going to happen. So they can be very paralyzing and very destructive. You'll often find anxiety in the context of other types of disorders as well, so it's not always a standalone. And the psychotic disorders, schizophrenia we hear of, but also there are other psychotic disorders that aren't schizophrenia, so you can have a brief psychotic episode, so it's shorter in duration, and other forms of psychosis. We hear about eating disorders, so anorexia, which is restricting the intake of food, and bulimia, which tends to be kind of binge eating and then purging by either using laxatives or vomiting. Substance use disorders, alcohol and drugs. And then there are a range of other disorders that are categorized. But again, we'll talk a little bit about some of these, but just the question is, you know, how is it that you move, as I said, from being considered to be somewhere in that blue area, moderate difficulties, to somebody saying, well, actually, you've got a diagnosable disorder. You know, you've crossed the line into something that's a little bit more serious. So when we look at that, certainly in any given year, they would say that about 1 in 4 people will actually meet the criteria, will cross that line. That's a lot of people. And 1 in 2 over the course of their whole lives in terms of adults will have ever met criteria. If you were to sit down, that doesn't mean that we all need to see a psychiatrist, but it means that we are meeting a criteria that would say, actually, if we were to kind of calculate or delineate all the things that you're experiencing, you would meet the criteria for disorder. And in Ireland, I know the census figures categorise people 25 and over, because the other category is 14 to 25. So looking at our population, so people over 25, in any given year, over 750,000 of us are going to meet criteria, an estimate for a mental disorder. And in our lifetime, those of us over 25, we're looking at about 1.5 million Irish people. So it's not an insignificant thing. So it's not unusual to experience a diagnosable disorder. But they, as you saw in the orange space, it wasn't just one point, it was also spectrum. So you can have more moderate or more severe or serious difficulties even within that. So what do we look for? Now here's a really interesting thing. I have 2 images there. So one is the person on the right who's saying is really obviously not okay. But very often what we have is the person on the left who looks okay, but isn't okay. And one of the real difficulties is working out for the people on the left who look okay and are smiling, but internally are not okay, you know, what are we looking for? What are the kind of signs? And also, what is it that a doctor would ask you? You know, what kind of questions would they ask you about to try and determine, have you got a serious mental health problem? So they would look for things that you can see that are much more observable. So how you're sleeping. You'll never go and be assessed for your mental health and not being asked about your sleep, your eating, and also on the other side are behaviours, things that you are doing that might indicate something is amiss. So it's usually a change in that. So sleeping can be oversleeping or undersleeping. So if your mood's very high, you're much less likely to sleep. You'll be awake all night. People who are depressed often describe an early morning wakening. They wake sometime between maybe 4 or 5 and they cannot go back to sleep. Other people will describe being unable to get out of bed. So there's not one particular pattern that is indicative of a particular difficulty. Eating, people can either overeat or lose their appetite altogether in a lot of kind of different mental disorders. And behaviour can vary. So somebody who maybe is very outgoing might become very withdrawn. Again, you might have somebody quite shy. If their mood has gone up, they might be seen very hyper. First time I ever worked when I was training, actually, I just thought I met somebody who was in really good form until somebody said, no, she's not in good form, her mood has gone really high. Not easy to recognise, because what you need to do is you have to know the person usually beforehand to know that it's different for them. So it's always about changes or disturbance in. So if you're always bubbly and up and you're still bubbly and up, you might just be having a good day. Whereas if people are noticing changes that occur over time, it's more likely to be something more significant. Then changes in our feelings, our thoughts, our thinking, and our perceptions. So, you know, we're a lot more likely for depressed to either feel sad or angry. You know, people often talk about depression as being anger without sort of the energy to actually express the anger, or feelings of guilt that come with things like depression. Whereas, as I said, anxiety is much more related to the feeling of fear and being worried. Our thoughts and thinking become very distorted in lots of different ways when our mental health becomes compromised, and certainly our perceptions, and to a degree. So in the psychotic disorders, you see very, very distorted perceptions. So people, you know, having delusions, fixed false ideas about things that are happening in the world, or seeing things that aren't there. So very distorted perceptions. And critically, what you'll be asked is, you know, how is this affecting your life? So if there are changes to how you're able to function in the world, again, that is more in kind of a classic sign that maybe something is not okay for you. Now, the real problem with a lot of this is that across the spectrum, all of us could say we've had changes in these aspects of our life to a different degree at different times. So I could say, look, I haven't slept that well for the last couple of nights. You know, I haven't been feeling too great. A bit more negative in my thinking. So there has to be a way to work out, well, okay, is this kind of, again, just a sign that you're maybe going through a bad patch, or is this a sign of a disorder, of something much more serious? So really there's sort of a simplified formula, and this is how the criteria are set up in medical terms. So they ask, what are you experiencing? So they'll go through all of the array of these kinds of things that you might be experiencing. How long have they been happening? So depending on the particular disorder, you have to meet criteria for a length of time that you've had those difficulties. So not sleeping for 2 nights mightn't be great, but it mightn't be too bad. Not sleeping for 2 weeks, and we might begin to say, actually, something's not okay here, because normally this really good sleeper is no longer sleeping. And then we ask about their eating. So we're back here. What exactly is going on? Now, I've lost my appetite as well. Oh, and I actually haven't been feeling that great, but I can't really put it into words. And I've missed some days of work. So you begin to say, here's all the things that are happening. And yeah, they've all been going on now for the last probably month, you know, most of the time. And then you begin to say, okay, we're moving towards something. And then finally, yes, it's this issue of impact. So that's how people assess mental health to get to a point of disorder. So you've got to, as I said, have those kinds of difficulties, they'd be significant, occurring over time, and having an impact on your life. And then depending on the kind of particular nature of the difficulties you have, you may then meet criteria for a disorder that we talked about. Does that make sense to people? Problem that we often have is, you know, what do you do then? Like if you saw somebody you knew who was experiencing those kinds of, like you saw signs that things were just not okay, you know, where do you start if you are worried? So we start by asking people. You know, one of the things that's really difficult is that what a lot of the research tells us is that we are poor at reaching out sometimes for help. Because to reach out for help, you've got to know how you feel, you've got to be able to put words on that and then kind of reach out to somebody and tell them. The problem is the more or the closer you are to kind of more serious difficulties, the harder maybe it becomes to find the words to explain it or to let people know. So it could be, so one of the things I would say is ask. And sometimes people say, I don't want to talk about it. But if you don't ask, there's no opportunity for somebody to tell you. But if you are concerned and you're talking to somebody, here's a couple of things that are most important. Listen first. Like listen properly. Because one of the things that we often do, and it's just the nature of being, you know, particularly if we know people, is that we often want to talk what we think is going on or give our kind of, you know, feedback on what we imagine might be going on or give advice quickly. But you need to start first by listening and really hearing what someone's saying, because if they pick up that you're really hearing them. I remember working with somebody and she said, for years I had loads of people to talk to, but no one who would listen or hear me. So having access to somebody doesn't mean that you feel heard. So if you're going to encourage people to tell you what's going on, you need to listen. And this key thing of empathy. And empathy is, as a concept, what it is, it says, I want you to imagine what it's like, or I'm going to imagine what it's like to walk in your shoes as if I was you, not as if I was me. Because again, what we often do when we hear someone is they say, oh, you know, this has been going on and it's been awful and I feel terrible. And somebody says, I know exactly how you feel. Now, most people who are depressed or anxious don't like to hear that. Because what you're really saying is, you're not hearing me tell you how I feel. My experience is different to yours. So we must empathize. We must say, that must be really hard. You know, small sentences and phrases, that sounds really difficult. It sounds like you're really frightened. It sounds like you're really down. Can really help, because once people begin to feel acknowledged, they're more likely to keep telling you what's happening. And then, you know, don't panic. Sometimes we get a bit freaked out and a bit worried if somebody's telling us something, we just don't know what to do. So it's about staying calm and reflecting a little bit about thinking, well, what does this mean? And you know, how worried am I? And do I need to take action? You know, if somebody's like a critical point of crisis, we need to take action then and there. If they're not, we have a bit of time to reflect and think about, well, how do I talk with somebody? And think about where to go. Here's the real thing. So most people, would you feel able to do that with someone else? These things, listen, empathize, yeah?
Yes, absolutely.
Okay. As easy to do with yourself? Listen to yourself, empathize with your own experience, reflect. Much harder to do with yourself. But the principle is the same. So if we're going to look after our mental health, we have to be able to do that for ourselves and hear and respond to what's going on within ourselves. rather than saying, oh, sure, I'm just like not trying hard enough, or I need to get on with it. You know, sometimes we need to hear and do some more listening than we tend to do. Just in terms of, at the end, I have a handout of services, and it's not an exhaustive list, but of some of the mental health services that might be of value to you. But just to say, in terms of public, there's a primary care service that's available to all people, a psychology service in primary care settings, and there is a counselling and primary care service as well for kind of psychotherapy that you can get, or counselling, but that's only for medical card holders. And other than that, we don't have really public therapy or counselling services available to us, and outside of that you might likely have to go to someone privately. And again, for people in the kind of that more mild to moderate difficulty, something like psychotherapy or counselling might be sufficient. For people who need medical, and most of our services in mental health, you route through your GP to most services. Your GP is the one person, if you have a good one, who'll be there throughout your life. Doesn't matter how old or how young you are, you can get to them. And that they do route and they can assess and do that initial. So if you're worried about yourself or someone else, you can get to a GP. They are trained to be able to ask those questions and to route you to services. And in a crisis, our options really are the emergency department. And if ever you're really, really, really worried about someone, you know, you bring them to the emergency department. If you think their life is at risk or anything like that, that is the route to go. And then special psychiatric services that you route through your GP, both outpatient and inpatient. So there are publicly available services, and they will have a suite of clinicians who work there, psychiatrists, psychologists, social workers, occupational therapists, pharmacists, who can all help find a way to support you. But it can be quite daunting for people to imagine going to those services. So it can be difficult to getting to the point of agreeing or acknowledging that you might need them. But important just to be aware that, you know, those are the kinds of services that you might be looking at. And for people who are in the orange, or if you're in the orange, that's where you need to be, probably someone specialist who can do a proper assessment and get you the kind of care that is, I suppose, trying to get to all of the aspects of your life experiences, not only things like medication, but maybe your family life or your personal life or past experiences you might have therapeutically, to help you in a rounded way. And of course, what we know is that recovery is possible, and earlier the better, so that a lot of people feel, oh God, you know, is this going to be it for the rest of my life? But we know that things can get better for people with the right kind of support. But all of the evidence tells us that if you get in early, even though you don't want to, possibly, or the person you're caring about doesn't want to, the earlier you recognise the signs, the earlier you get assessment, and the earlier you get the right kind of support, the quicker you will recover, and the better your longer term prospects. So it's a kind of don't delay message, really. And you know, you're better to be a bit cautious and then hear that actually things aren't as bad than to wait and wait and wait and wait and wait. And then suddenly you're really in crisis, or they're in crisis, and things have gone too far. Just before I finish up, I want to just talk about then this 5 a day for mental health and well-being. Very interesting. There was a national, it was the National Economic Foundation in the UK that did this, and they were looking at productivity, and they were like, well, actually, if we do some research, what seems to make a difference? Well, people who are good well-being and are mentally healthy are more productive, so they're more economically kind of useful to us. And here are the 5 things that seem to really make a difference. And when we think about it, they come right full back circle to our definitions of mental health in the first place. So they are to take notice, to connect, be active, give, and keep learning. So I'll just quickly go through those before I finish. And just to really kind of take the take-home message that if you're looking at promoting or nurturing or minding your mental health, these are the kinds of things that, if you do these, are more likely to keep you mentally healthy and well. It's important to say that the closer you are to mental health, the easier it is to do these things. So if you're heading towards more serious difficulties, it's going to be much harder for you to do these things. It's a bit like saying to somebody who's got angina, you know, to do all the things that are meant to prevent any kind of cardiac difficulties. Once you've got the symptoms, it's much harder to actually do the preventative stuff. But these things matter, and no matter for any of us, will make a difference. So one is to take notice, firstly, of yourself. We're notoriously bad at sort of being so concerned about everybody else that we're neglecting to really notice what's going on for us ourselves. We need to do that. But also a big movement now around things like mindfulness, that kind of Buddhist meditation idea that we focus on the present. So if you're anxious and you focus on the present, it stops you from being so caught up in the future and all the things you're worried about. And beginning to notice those very small things in life, or just that kind of connection. I remember having that experience at, I was sailing once and thinking, wow, like what is this that I'm feeling? And it was pleasure. I thought, jeepers, this shouldn't be a memory, pleasure, but it was, because I had a moment where I kind of was so in that moment that I worked out that I felt this kind of joy and pleasure for being on the water. And we're often so distracted by everything else that rather than being mindful in that kind of taking notice, we've just got full minds, and that's not helpful for us. Connecting, as I talked about, we're relational beings. We're born to be in relationship with others, or even people who are kind of up in temples on mountains are in relation with something spiritual. So your spirituality might really make a difference to you, but we are, you know, to have some meaningful connections with others. And it's finding people who you like and want to be around, who contribute to your life, and working that out for yourself. Being active, there's a strong, strong relationship between our physical health and our mental health. So that if you want, and this is the age-old one that we hear, 30 minutes, 5 times a week, doesn't have to be, you know, you don't have to be in the gym doing spinning classes, you can be walking. And there's loads of gains because it releases endorphins, it gets you distracted, you begin to be able to take notice of the world around you. So there's huge net gains for that. Giving, we talked about the importance of contributing, so that when we look at this, they said if you find meaningful ways to feel like you can give a little, and be involved in things that make sense and have meaning for you, that certainly matters. And to keep learning. So there's this idea that we kind of, when you feel very stagnant in your life and things aren't moving forward, it's very hard to feel kind of good about yourself. Whereas if you can keep your mind and your interests occupied, that certainly will help you with your mental health. And as I said, it's almost, the problem when I talk about the 5 a day is that it's almost like saying eat 5 fruit and veg every day, and most of us eat chocolate and crisps and other things that we should be doing. So the knowing how that this helps us doesn't always translate into the doing of it. So I acknowledge that it's very difficult sometimes to do these things. And I said the further away you are from health, the harder it will be to do these things. So one of the things that might help, and will help certainly, is beginning to be much better at finding the language of emotion and connecting with your emotional self. And learning what are the feeling words. Talking to somebody about this recently, he said, I cannot put in words how I feel, and it's making everything very difficult for me. So we need to begin to do that, because that will help you, you know, in all of this, if you can begin to work on emotion. When I have this stand up to stigma, what I'm really saying is the stigma you hold internally around mental ill health. So a lot of us say, yeah, oh yeah, of course, you know, if my friend was going through that, but me? No, I don't want to think that I am going to be that person. I don't want to acknowledge my vulnerability to myself, never mind anyone else. So that the internal stigma that we hold stops us often in our tracks from either acknowledging how we feel or reaching out and getting the help that we need. And as I said, the final thing is this issue of not berating yourself because you feel not okay. It is normal not to be okay. That is the most normal human condition that there is. And where people fall down, as I said at the start with some of the people I've worked with, is that they beat and beat and beat themselves with a stick because they feel okay, because they don't feel justified in that or feel their life is too good. But if you can begin to be more accepting, not just of yourself as a person, but of how you feel within yourself as a person, there is much more chance that you will be good to yourself, you'll be kind to yourself, and you'll take, you know, good steps to mind yourself and your mental health, and also to reach out and get that help if you need it. And on that note, I will leave it because I'm slightly over time. Thank you very much. Tonight's lecture is all about acknowledging that mental health affects every single one of us, and that there are things that we can all do that will support and nurture our mental health, but also there are things that we need to look out for that might be signs that maybe we're kind of experiencing some sort of moderate or serious mental health difficulties, and we need to think about those and how to respond and take action.
The take-home message was to listen to the patient, well, for me the patient anyway, and the person, and not being afraid to listen and to take on what they may have, and to help somebody. It was well aimed at everybody in the audience. So absolutely, I'll be back for more.